my name's Riley. I work here at the hospital. I'm an X-ray CT tech. I went to Pima Medical Institute for school. It was a 2-year program. Most programs for this job require a 4-year deal. A couple places that they have this program are Bellevue Community College, Tacoma Community College, and Wenatchee. They're 4-year programs because they require 2 years of prereqs before you do the actual 2-year program. Where I went, they included all of the prereqs in the program, which is very nice. 2 years and done. I like my job because I get to help people in the medical field. Technology is always changing and growing and advancing. I can pretty much work anywhere in the country. Once you're registered as a radiologic technologist, you can work anywhere in the country. You can travel, make good money. You can go into different modalities like MRI, CT, mammography. Options are endless. Another thing that I love about this job, when I got into my program, I wanted to go to school for something to help people, but I wanted to do something where I knew I could find a job instantly after graduating. This job is very high demand. Right after graduation, you can pretty much find a job anywhere, which is great. With X-ray, you're here at the hospital pretty much 24/7. You are a part of the trauma team. You're going everywhere in the hospital. I have the X-ray room here, but we can go portably. With our portable machine, we can go to the ER, to the floor, to the critical care unit. We even have a machine to go into OR for surgery cases. We do that quite often as well. Here's a camera for the X-ray machine, and the table here behind me will capture the image when the patient is laying on it. And then we have another part of the room where you can have a patient standing and doing X-rays as well.
It is heavy, yeah, and they're all magnetic blocks, so if you stop, it will stop. I love my all move button because I can move it any which way I want to by holding that gray button here. If you want to take a picture of somebody's shoulder, you would have them here in your light field and then give them instructions, hold their breath before taking a photo. You can see broken bones, pathology, all that kinds of stuff with X-ray as well. Pretty interesting. I would go to school if you enjoy math and science and physics because you have to know all of that to do the job. Yeah. I love it. Wouldn't change my job for anything.
I'm Mallory.
I'm Maddie.
And we do ultrasounds at the hospital. And ultrasound uses sound waves instead of radiation to create pictures of your insides. A lot of people think that ultrasound is just used on babies or for babies, but pretty much anything soft tissue in the body we do. This is a common carotid artery here. The black part running through there. The red on there is the blood moving through there. And then we'll put this Doppler on, and it allows us to hear it as well as record a waveform for the doctor. In order to be an ultrasound tech or officially a diagnostic medical sonographer, you have to go to school for it. There's normally about 2 years worth of pre-requirements to get into a program, and then the programs are 2 years. I went to Tacoma Community College.
I went to Spokane Community College.
All of the prereqs are pretty close to the same. It's about the same you'd see for the nursing program, but we also have to take some physics. And then the physics in the program is so much easier than the physics to get in, so it just sounds scarier than it is.
You do have to take a state registry for physics, ultrasound physics though.
Yes, as well as whatever specialty you're in. Like we said before, ultrasound's more than just babies. We of course can look at babies, but we also do ultrasounds of carotid arteries, thyroids, abdominal organs,
Pelvic organs,
yeah,
looking for blood clots,
yeah, breast imaging. On pediatric patients or newborns, we'll do hip ultrasounds, spine ultrasounds, neonatal head ultrasounds. There's some specialties where you can go into musculoskeletal, so you're looking at joints, ligaments,
or echo, which is hearts.
For the most part, when we're scanning our patients, if they're outpatients, they come into our rooms and we scan them. Or if they're able to transfer from the emergency room, we'll have them come up here. Sometimes we have to go portable because they're not stable enough, so we'll just take our machines and go to their room, which you try and limit that because it can be really hard on your body, especially shoulders, wrists. There's a lot of injuries like that. So
All the awkward angles.
having patients come to your room really helps. So having a great coworker really helps because then instead of the awkward angles, she can be on the other side scanning and I'll just run the machine.
Teamwork.
Yeah, makes the dream work. I'm from here, basically born and raised in Aberdeen, go Bobcats, graduated in 2003 from Aberdeen High School. I've been at the ultrasound, or not ultrasound, I've been at this hospital for 14 years.
I'm a graduate of Montesano, 2014, and born and raised. I only left for school for this, so a lot of people are really appreciative of us and come in, and it's coming to us as outpatients. They're not as worried as some of the inpatients are, and so really pleasant. You get to know them, and
You get to meet a lot of different people and they tell you just, little bits about their lives here and there, and it's really fun to hear all their stories, and you get to, be there for them and help them answer some questions that's making them nervous or causing them pain. You get to take part in that with the doctor to help them see what's going on so they can feel better. We've got a great team here.
I've
We
worked
really
at a few other hospitals, and I chose here because of this department. Everyone is great, so.
It can really make your day that much better, even when it is a crazy,
Yeah.
busy, rough day. Loving your coworkers is pretty awesome.
Yeah, they're my best friends.
Hi, my name's Kim. I am a CT tech at Harper Regional Health. What CT is, it is computer-aided tomography, and it requires an X-ray camera, and the patient will lay on the table, go through the center of the circle as the camera moves around the patient, and it X-rays the patient as the patient moves through. The X-rays land on the detectors. The computer takes the images and creates axial, sagittal, and coronal images for the radiologist to read. To be able to do CAT scan, first you need to be in a radiologic technology X-ray program, either a graduate or currently in the program, to be able to do the CT training. Some schools do offer it along with the X-ray program, or you can take it after you graduate, or you can do an online program that you can do along with your employer to be able to sit for the American Registry of Radiologic Technologists exam for CT. So my daily activities, of course, is patient care. We take care of patients. We start their IVs. We explain what we are going to do with them. Most exams do require a contrast injection, so we'll be doing that for them also. We also are an important part of the trauma team. We do many trauma exams on accidents and various injuries for patients. We scan the entire body. We also are part of the code stroke team. We are the first line of testing to see if that patient has a bleed and that they can have the TPA clot busting medication. Also, we're in the front line with COVID. We scan patients that they think have severe COVID infections. So the type of person to be able to do this career, they need to be quick, they need to be good with patients, have good IV therapy skills, and be able to handle the stress of traumas and anything that comes down our way. I like the excitement. It's not a desk job. You're on your feet. You run all over the place, and I like helping people. I like to get that good exam.